The neonatal period, which starts at birth and lasts for the first months of life, is characterized by significant psychological changes across all organ systems. During this time, infants begin to respond to various external stimulation. And it's important to recognize that an infant's physical and psychological development is deeply intertwined with their social relationships, and which making a role of parents crucial in understanding newborns' developmental status. Welcome to Maiden Moments. In the third episode of my child series, we will explore the vital aspects of ideal parenting for newborns. Caring for an infant demands a high level of commitment, since their needs are often urgent, continuous, and sometimes difficult to interpret. Parents must be attuned to their baby's cause and respond with empathy. Various factors can impact a parent's ability to fulfill this role. Pregnancy serves as a time for psychological preparation for significant responsibilities of parenthood. Expectant parents may feel ambivalent, especially if the pregnancy was unplanned. Financial worries, health issues, previous miscarriages or stillbirths, and other life crises can hinder the bonding process. For adolescent parents, the challenge of setting aside their personal developmental goals, such as maintaining an active social life, can be particularly overwhelming. The transition to parenthood is both a unique and stressful developmental phase. Parents' past experiences, especially traumatic ones like the recent loss of a loved one, serious illness, or loss of another child, mental health issues, infertility struggle, or financial hardship can influence their ability to form a nurturing relationship with their newborns. Research indicates that a higher number of adverse childhood experiences, or ACEs in initials, can lead to increased parental stress, a more authoritarian parenting style, a higher risk of child abuse, and insecurity in parent-child attachment. Identifying these parental ACEs and addressing them through community resources like parenting classes and support groups can help build resilience and mitigate the impact of these experiences. Support from partners and close family members during pregnancy is also crucial. Such social support can enhance resilience against ACEs. As parents prepare for their child's arrival, they face many important decisions. One of each is how to nourish their infant. Breastfeeding offers numerous benefits, including fostering bonding, providing education on breastfeeding during parental care can boost maternal confidence, alleviate stress in the newborn phase, and promote higher rates and longer durations of breastfeeding. Having a support A person present during labor can lead to shorter labor times and fewer complications, including cessation. These positive outcomes are often enhanced when the support person is specifically trained for uh, continuous assistance. Early skin-to-skin contact between mother and infant right after birth has been linked to increased rates of longer duration of breastfeeding. New parents often appreciate having uninterrupted time to bond with their newborn. Increased mother-infant contact in the early days can enhance long-term interactions between them. However, while early separation can be very stressful, it does not necessarily prevent a mother from forming a bond with her infant. Shortly after birth, newborns are alert and eager to engage and nurse. The initial alert phase can be influenced by maternal pain relief medications or anesthetics, as well as fetal oxygen deprivation. Newborns have limited vision with a focal range of 8 till 12 inches, about the distance from a breast to mother's face, and they possess an innate preference for looking at faces. Their hearing is also well developed, and they tend to turn toward female voices. These natural abilities enhance the likelihood of mutual gazing between mother and baby during crucial interaction. The first social interaction typically lasts around 14 minutes before the baby enters a phase of drowsiness. Following this, shorter bouts of alternate with sleep. If a mother misses her baby's initial alert phase, she may not experience a prolonged social interaction for several days. Adjusting to life outside the womb necessitates a rapid and significant psychological change, including lung inflammation, circulatory rerouting, and activation of the digestive system. The behavioral adaptation requires are equally substantial to secure nourishment, maintain body temperature, and ensure safety. Newborns must respond appropriately to a broader array of sensory inputs. Infants' behavior can be categorized into distinct states which may reflect their inherent ability to manage arousal levels. 6 states have been identified: quiet sleep, active sleep, drowsy alert, fuzzy, and crying in altered state. Infants can visually focus on objects or faces and track them horizontally and vertically within a month. They also instinctively turn toward new sounds as if trying to locate their source. If they become overstimulated, infants may self-soothe by looking away or sucking on their lips or hands, which helps increase parasympathetic activity and decrease sympathetic nervous system activity. An infant's behavioral states influences their muscle tone, spontaneous movements, EEG patterns, and reactions to stimulation. For instance, during active sleep, an infant may show diminishing reactions or repeated heal sticks, while in a drowsy state, the same stimulations may provoke fussiness or crying. During feeding or when infants are alert and engaged with their parents face to face, it's common for both to seem completely absorbed in each other. If infants feel overwhelmed by their parents' voice or actions, they may turn away or close their eyes, which can prematurely end the interaction. Conversely, the infant might be ready to engage while the parent appears distracted. It's beneficial to ask new mothers about their emotional well-being and specifically about any history of depression, as this can facilitate referrals for a therapy that may offer long-term advantages for both the mother and child.